Hi, my name is Erica Jain. I'm co-founder and CEO at Healthie. Healthie is an ONC certified API-first EHR for longitudinal healthcare. So we're really proud to work with amazing customers across longitudinal care spectrum and over 25 specialties from behavioral health, women's health, nutrition and coaching, and longevity. So we actually started the company 10 years ago. My dad's company started offering employee benefits, and they started seeing a dietitian, a doctor, a therapist, a chiropractor, all together, and it was a modern collaborative care team. Over the course of about a year, my parents lost 35 pounds each, completely transformed their lives, and I saw that and really started asking the question of, why doesn't everybody have access to this type of healthcare? And so my co-founder and I just started talking to providers, anyone who would really talk to us. And time and again, what we heard from our providers was that there was no technology to support the types of healthcare that they were providing. So they were either trying to piece together a bunch of tools made for consumers, or candidly using pen and paper. So we just started building all of the tools that they were asking us to build, and that was really the impetus for Healthie. Customers come to Healthie because they're looking for an ONC certified EMR that allows them to deliver clinically excellent healthcare at scale. Our customers are leading innovation in healthcare, 50-state, multi-payer, multi-specialty, single specialty. What they're really driving at is, how do I improve healthcare outcomes at scale for outpatient care? It is undifferentiated to have the underlying infrastructure for it. You want to build technology that is business differentiating to you, and that's what our customers come to us for. Whether that's scheduling, EHR, client engagement, the list goes on and on and on, but really it comes down to having the fundamentals upon which they can build their own unique and engaging experiences on top of our technology. We provide business critical, healthcare critical software to our customers. And with that, that's an incredible amount of responsibility, particularly in healthcare, to deliver. One of our core values as a company is reliability. That's a term we use internally, and it's also a term that we use externally to really making sure that we're constantly providing value, in touch with our customers, building for our customers, and also anticipating where the puck is going, thinking about, where is healthcare going? What are our customers going to need and want in 12 to 18 months down the line? It's really exciting to see the amount of unprecedented, and candidly, in my opinion, long overdue innovation in healthcare. Now is the time whereby we're seeing healthcare follow in the footsteps of industries like fintech and consumer tech. And there are so many macro forces contributing to that, whether it was accelerants post-COVID, whether it's consumer readiness to adopt and pay for healthcare, whether it's changing reimbursement, whether it's policy and administration. All of the above is really contributing to technology playing a centralized role in empowering patients to take control of their health, really allowing healthcare to rethink its traditional and entrenched systems and say, now is the time for us to demand and want a better system. I often think about, what would the world have looked like and what would the healthcare system have looked like if a company like Healthie had existed 100 years ago? Where would we be on personalized, proactive, preventative medicine? That would be amazing. I think, unfortunately, the healthcare system had been set up such that there were so many competing, conflicting forces across payers, providers, government, entrenched systems, that you had this piping of just really, really complex set of infrastructure. And I think, fortunately, the tide is turning, whereby innovators like Healthie can really start to push forward, and our customers push forward what it means to deliver innovative healthcare. When we actually created our first deck, this was back in 2016 sometimes, we actually had to footnote and define what telehealth was. And I look back on that and chuckle, because nobody knew what telehealth was. It was this very niche, very specific, seeing someone on a video call. And you look at today, and telehealth is just this very tip of the iceberg when it comes to delivering longitudinal healthcare. There's all of the asynchronous care, data being collected, providers making real-time important decisions, population health, social determinants of health, that are really pushing the ball forward when it comes down to delivering on better healthcare for more people. And I think that's really, really exciting. We actually view AI as being layered across our entire experience from the administrative experience, from the clinical experience, to the patient experience, and of course even the developer experience. We call it 100 use cases of AI within the EHR. And our ultimate goal is to abstract every single click from the clinician's workflow while still making sure that clinicians and administrators are at the helm of and really owning how AI is driving forward their clinical experience. What I'm most excited about as we look ahead is the opportunity for Healthie to partner and continue to partner with other innovators in healthcare. We launched Healthie Harbor, our marketplace, last year, and we've already seen over 70 companies join our harbor and say, we want to help support Healthie customers in delivering end-to-end solutions. My co-founder Kevin said it best last year when he said, healthcare is too big of a problem for one company to solve. And we view our place as a node within a very big and important ecosystem. And in total, we can really drive forth all of the innovation in healthcare at scale. So that's something that we're really, really excited about and leaning into.